event tonight is part of Sister Bay Stories, which I think most people here probably know. But it's also part of Door County History Days this year. This is the second annual event that brings together all the historical nonprofits, of which there are many in Door County. You know, there's probably, if you count some of the cultural organizations, probably 20 of them, 24 of them. Most of them are involved with History Days, and we had the big media event yesterday for it. And it was great. A lot of people, some TV coverage, and the whole attempt is to bring all these organizations together and with a commonality of interest and get everybody going to each of the individual facilities, like this one, Corner of the Past, and getting involved with Sister Bay Historical Society. So tonight we have a very interesting presentation. Brian Stephens, the CEO of Door County Medical Center, is here to talk about the new Sister Bay Clinic and Rehab facility. There's a historical angle to this, obviously. It's the organization's 80th year, so there's that. But as residents of the county, I think we're all super interested in what that facility means for us individually. You know, that's I'll let Brian take it from here, but thank you for coming. And if you'll just bear with me, I just want to mention that there's 4 more Sister Bay stories coming up. One in July with Dick Burris. A lot of people here probably know him, talking about life and as a kid growing up in Sister Bay in the 60s and 70s. Paul Bokelman, who's the son of Rudy, who had Rudy's Diner, where JJ's was for many years, and now there's a new restaurant there. Then Paula Anschutz of Sister Bay Bowl, a long storied history in September. Chris Hecht, Fire Chief in Sister Bay Liberty Grove in October. And I hope you can come to some of these. So thanks for coming out tonight.
Thank you very much. Thanks for being here. I'm Brian Stephens. I'm the CEO of Door County Medical Center. I have lived in Door County for 18 years. I'm originally from West Texas, from Abilene, Texas, and my wife is from Wisconsin. So, you know, everybody, the follow-up question is always, well, how'd you get to Wisconsin? Well, my wife is from Wisconsin. We both were working in healthcare right out of college, and we were living in Nashville, Tennessee. And when we started having kids, we wanted to be close to family. So it was either picking Texas or Wisconsin, and we were blessed to find opportunities here in Door County with Door County Medical Center. And like I say, I've been here now for nearly 2 decades. But you may wonder, we're going to talk about the history of healthcare in Door County tonight. You may wonder, how does a guy from West Texas know anything about the history of healthcare in Door County? I've learned a little bit in the 18 years that I've been here about the history of our organization. We'll go through some of that today. We actually have some experts in the room who are more experts than I am about the history of healthcare in Northern Door. So as questions come up, I may pick on a couple of you in the room tonight. And but then we will end with talking about the new clinic in Sister Bay, which we're super excited about. We'll tell you how that came to be, how we decided to build a new clinic here in this community, and why we think it's important for the next 20 years, if not longer, of providing health care in Door County. As I mentioned, my wife's family is from Wisconsin. Actually, her dad graduated from Sturgeon Bay High School in the 1960s. And we do have a little bit of family history in Sister Bay specifically. So my wife's grandparents were Warren and Alice Sodeman. Reverend Warren Sodeman was a Moravian minister up at the Sister Bay Moravian Church, and then at Ephraim, and then later in Sturgeon Bay. And I do remember when they were both alive, Warren and Alice, and when we moved up here, they were both still living. And it was a blessing to us that our kids got to know them before they passed away a few years ago. But one of the stories that they would tell is how they ended up in Sister Bay. So just a brief family story before we go too much further. But Warren was from Jamestown, North Dakota. Alice was from Lake Mills, Wisconsin. They met at a Moravian youth event and fell in love. And as Warren was coming out of seminary to start his first pastor job, and he took the job up in Sister Bay, he was excited about that, and they got married, and they went on their honeymoon, and then they immediately went to Sister Bay after their honeymoon to start his pastorship up at Sister Bay Moravian Church, only for Alice to find out that they would actually be sharing the home that they were living in with another person. So you think, you know, you're married and you're ready to start a new life, and you got a home that comes along with the job. That's fantastic. But they actually had to share that home, and I remember her telling stories about that. And if you knew Alice Sodoban, she was very particular about how she kept things in the home. So I can imagine that would have been a little bit of a stress in those early years if the other person living with them did not keep things quite as tidy. So that's a little bit of our family Sister Bay history, but that's about the extent of it. I want to talk a little bit about healthcare, the history of healthcare in Door County. I'm borrowing heavily from a couple of articles on that. So there was an article written in Door County Living magazine back in May of 2010 called Changes and Constants in Healthcare Delivery, if that's one that you'd want to look up. And then there was another article in the Peninsula Pulse in December of 2021 called Scandia Village Celebrates 40 Years of Service. So I'm going to borrow a little bit from those articles as we talk about some of the history, but then also want to let you know that I did talk to Mike Flood a couple of weeks ago. Wanted to get his perspective on history of healthcare in Northern Door, so I have a few notes from him. And then also our doctor, Dr. Josh Rebhan, who's been here for over 2 decades, and he was able to contribute some information as well. But let me just start by letting you know that the beginning of this article, Changes and Constants in Healthcare Delivery, starts like this. In the winter of 1864, tugboat captain Robert Noble's legs froze during a stay on Washington Island. Gangrene developed and Noble desperately needed medical attention as his condition deteriorated. A physician, Dr. Farr, happened to be in Sturgeon Bay looking over mill property that he was considering for purchase. The visiting doctor was quickly summoned to the Cedar Street house on 3rd Avenue to care for Noble. Realizing an amputation would be necessary, Dr. Farr promptly sent for instruments to be retrieved from Green Bay and then borrowed a butcher's saw to complete the procedure. That sounds awful. Captain Noble came through the ordeal well and continued to serve as a prominent citizen of the period. That's like one of the first documented healthcare stories that we have in Door County, so that was mid-1860s. Throughout that time period, patients often traveled to Green Bay for treatment, and sometimes their conditions worsened considerably while awaiting transport. Following the incident of Captain Noble's amputation in 1864, public demand for a resident physician heightened significantly. Approximately 1 year later, villagers introduced Dr. Pommier, P-O-M-M-I-E-R, or Pommier, to come to the county by collecting a subscription fund of $1,000. He was then replaced in 1867, and then another doctor came along a couple of years later named Dr. Young. Over the next 30 years, other physicians followed Young's lead by turning their residences into Door County's earliest hospitals. So we really didn't have a hospital in those early years. This is a picture of the People's Hospital in Sturgeon Bay. And so that was one of the first hospitals, but again, one where Dr. Sibry, in this case, had just turned his home into a hospital. And that's kind of how it went, at least until the turn of the century. This picture is from 1902. So another physician who was prominent in those early years was Dr. Eglin. Now, he founded the Eglin Hospital. That was truly the first hospital in Door County. It was on his place of residence, but he expanded it to the point where it actually became a true hospital, not just rooms in his house. So you can see the Eglin Memorial Hospital in 1920. Actually a very nice looking building. The original building did burn down and was replaced on this same site with a new facility, and we'll show you that one in a little bit. They even had a postcard. They were so proud of this building that they had a postcard. I can't imagine sending someone a postcard with the hospital on it saying how much you've enjoyed your visit in Door County, but wouldn't recommend that today, although it would be good advertising for us. But that's apparently how much they thought of Dr. Eglin's Memorial Hospital back in those days. A lot of what we know about healthcare in the early 1900s is on display at the Door County Historical Museum on 4th Avenue in Sturgeon Bay. You can see here a tray of historical medical supplies that's on exhibit there. But that hospital, Eglin Memorial Hospital, sits on this site. You can see the aerial view here. And so for those of you who are from this area or know the area well enough, you know that a large part of this building still exists today, and it's the Dorchester Nursing Home on Jefferson Street, now called Sturgeon Bay Health Services. It's had several different names throughout the years, but locals, I believe, still call it the Dorchester Nursing Home. Probably always will. Just like they'll always call our facility Door County Memorial Hospital, even though we haven't been Door County Memorial Hospital for nearly 10 years now. So, but prior to 1943, like I say, healthcare was provided through privately owned facilities, but a group of leading citizens in the county organized a nonprofit hospital corporation in 1943, which was officially recognized by the IRS in October of 1944. The corporation acquired the building formerly known as Eglin Memorial Hospital and renamed it Door County Memorial Hospital. And the only thing I've ever heard about the memorial being in the name is that it was in memorial to those who had served and died in World War I. But I heard a story just before this presentation that there may have been a little more to that as well. So this is a picture of the lobby in the original Door County Memorial Hospital in 1944. You can see some of the cutouts, and there's actually a sign if you look very closely that says strictly cash. So I don't think we could get away with that today. You probably want us to bill your health insurance these days, but back in those days apparently it was strictly cash. They weren't going to bill any other source or take anything else for payment in 1944. But the hospital served the county for 20 years at this location until there was a need for expansion. Here's a few more views of it though. In the 1940s, this is the hospital kitchen facilities. As you can see, they're preparing patient meals and getting them ready to take them out to the patients. This is actually an x-ray machine from Eglin Memorial Hospital or from Door County Memorial Hospital. We're not sure which, but an x-ray machine back in those days. These are scrub sinks in the original Door County Memorial Hospital, so you can see the ladies scrubbing in, presumably for a surgical procedure or something else. I find it really odd that medical records apparently shared the space with the with the scrub sinks, so it's a lot of paperwork there. And we complain about the electronic health record today, but you can see that keeping detailed records has always been a part of healthcare. This is an actual procedure taking place in the operating room in the 1940s or 1950s. This is a picture of the old hospital nursery. By my count, we're looking at least 5 babies there in the old hospital nursery. Not in my 18 years at Door County Medical Center has there ever been a time where we've had 5 babies in the birthing center at the same time. So we would love that. But we just don't deliver as many babies now as we once did in the community. Hence the baby boomer generation back in those days. And then here's a patient room from the late 1950s as well. So you can see, of course, not private at all. It looks like they did have some curtains that they could pull around. But we actually didn't move to all private rooms at Door County Medical Center until 2010 when we built our new inpatient addition, which I'll show you pictures of later. But there were shared rooms, I would say, for the majority of the history of the hospital in Door County. So in the 1950s or early 1960s, a citizens committee was formed, and you can see several of the folks on this slide. I'll read the names to you if you're interested. Mrs. Howard Bosman, co-chairman L.F. Matthews and C.R. Christensen, D.C. Pisha, what is it? Pache, thank you. D.C. Pache, Fred Peterson, Virgil Starr, Frank Kellner, Dr. John Beck, Don Reynolds, C.H. Herlash, and E.B. Mickelson. And then there's a couple of people who aren't shown in the picture who were also part of the committee, Milford Prangy and Otis Trodahl. And so in March 1959, the Board of Trustees found it necessary to create this Citizens Committee to pursue building a new hospital. In 1962, the committee raised $470,000 for the new hospital, one of the most successful fundraising campaigns in the history of Door County to that point. I probably should have done the math to see what that is in today's money, but that's a sizable amount of money to be raised in 1962. Apparently, Door County has always been a generous community, even like it is today. So you can see a sign here as they stand out in the apple orchard, future site of the new Door County Memorial Hospital. But you know, I'm told by those who remember the days of the 1960s and that new hospital being built that people thought they were crazy for building it so far out of town. Of course, it's still on the edge of the city limits of Sturgeon Bay, but now with the main highway and the Bayview Bridge coming right through there, it's definitely a more convenient location than it probably once was. I should tell you that a large part of the funding for the new facility that was built in the 1960s came through a federal grant, and the corporation raised funds to construct the second facility in the history of DCMH on Orchard's property, like I say, on the outside of Sturgeon Bay. So this is Door County Memorial Hospital under construction. And actually, if you go down 16th Place, you know, you can see the bones of what still stands today on 16th Place. The next slide shows you the completed building. And this is an aerial photo from 1964. Notice that there were only 2 floors when the building was originally constructed, and a 3rd floor was added later. I think I have a picture of that at a later date. The 3rd floor was added to create the nursing home or the skilled nursing facility just a few years later. But originally a 2-story building, and the front of the building, the front of the hospital, was on 16th Place in Sturgeon Bay. Of course, today, everything that we've built in the last couple of decades is on the 18th Avenue side, and we actually use what was the main entrance and now is the employee entrance of the hospital. So a little bit more family history here. So I told you my father-in-law went to high school in Sturgeon Bay. His summers in high school, he would work for Evergreen Nursery. And he and Greg Meisner, who of course now has his own Meisner Landscaping, my father-in-law Bruce Soderman and Greg Meisner actually did the plantings that you see in this picture out in front of the main entrance. He still remembers doing that. He's very proud of it. So unfortunately those plantings no longer exist. So here's the ribbon cutting ceremony held on October 3rd, 1964 of the new building. And then here's some interesting pictures of the moving day in 1964. You can see the truck, the Peninsula Transfer truck. You know, there's only a handful of businesses that have been around in Door County since that time. Peninsula Transfer is still one of them. Now, I know their sign is still up on 15th Avenue. I don't know if they're still in business, but their sign is still up on 15th. And of course, Door County Memorial Hospital, that is still our legal name, so we've always been that legal entity, so we existed from that time. Technically, Door County Advocate still dates back to that time. And then I heard the other day about another one, but I can't remember what it was, but it was something in Northern Door. Do y'all remember? There's another one that dates back to the 1960s, a company that's existed continuously. Door Reminder, maybe? We talked about that, yeah. But that doesn't exist today, does it? No. Going Garbage did? Existed that long ago? Oh, fantastic. I would not have known that. Yeah, and restaurants, of course. Yeah. So anyway, interesting, the Peninsula Transfer moving truck there on moving day. Moving day was on November 11th, 1964, so perhaps fittingly on Veterans Day for a facility that was named in memory of those who lost their lives serving our country. Another picture of moving day as they unload a patient in 1964 from an ambulance into the new facility. And you can see June Peterson showing off, our surgical nurse there in 1963, showing off her new sterilizer in the surgery suite. Now, the folks who work in our surgery department would joke with me that we still had those sterilizers until a couple of years ago, but we did have to replace some older sterilizers recently. But rest assured that we have state-of-the-art sterilizers now. This was the new laundry room in 1964. That no longer exists. We outsource our laundry now to Evenson Laundry, but that it looks like we started out doing our own laundry back in those days. And then again in 1970, that's when the 3rd floor was added to Door County Memorial Hospital to create what at that time they called an extended care center, but now known as the skilled nursing facility. And that was the skilled nursing facility on that 3rd floor until 2019 when we moved into our new facility. This is just a picture of a switchboard operator in 1970 in the new hospital. You remember the picture of the old x-ray machine. This is an x-ray machine from around the mid-1970s. And this is also a good time to mention that in 1975, the Door County Medical Clinic was established. on the corner of 18th Avenue and Rhode Island Street. And the clinic was far-reaching. So some of the history of healthcare in Northern Door was Door County Medical Clinic starting to create practices up in this area as well. We probably didn't know it at the time, but this was really a turning point for the organization to become what it is today. Obviously, our clinic operation and all of the ancillary services that support the clinic make up a large part of the service that we provide to the community today. In fact, only 11% of our revenue for Door County Medical Center is actually inpatient revenue. 89% of our revenue is all clinic and outpatient revenue. So definitely the biggest part of our business these days. This is a picture of the auxiliary presenting a check, and the auxiliary is also 80 years old. It was established the same year that the hospital was established. You can see from this picture that the auxiliary and the foundation have been generous supporters of everything we do at DCMC since the beginning. The foundation was that changed legally and kind of formally established in 1990, but it has existed since the beginning of Door County Memorial Hospital. This is a picture of the sign. There's some debate about the old Apple logo. I have been told it was created because the hospital is built on orchard property, but I've also heard that this was actually a cherry orchard that existed there. So then the Apple logo wouldn't make as much sense. It could have been a play on words in terms of apple a day keeps the doctor away, something to that effect, but nevertheless that was our first logo. But that actually was just created in the 1980s. We believe prior to the 1980s there was no logo. We have letters from back then that were just on block letterhead at the time. So. This is a picture of Marge Ostrand, one of our OB nurses in the new OB unit. OBGYN services were started in the hospital in 1977. We actually believe this picture was taken sometime in the 1980s. In the 1980s also, Dr. John Herlash was instrumental in bringing laparoscopic surgery to Door County. We were on the cutting edge with this type of procedure at this time. Pun definitely intended there. But Dr. Herlash was always a visionary. He really brought a lot of new services to Door County. I think I have a slide that talks about, that's another picture of Dr. Herlash. This is an article talking about the laparoscopic procedure. So we were doing laparoscopic procedures in Sturgeon Bay before they were doing them in Green Bay. And then you can see also that he was within the group that started the paramedics program. So it says under the leadership of Fritz Brunswick, Joe Mango, and Dr. John Herlash, the county board, and the strong community support, our service became the first rural paramedic service in Wisconsin, and there are some claims that we were the first in the United States. Personnel completed their paramedic training in 1979 and started responding as paramedics in 1980. So Dr. Herlash definitely had a big hand in that as well. So it seems like every couple of decades, a figure like Dr. Herlash comes along that kind of changes the complexion of Door County Medical Center and what we can do for the community. So he played that role. We have another general surgeon now, Dr. St. Jean, who brought robotic surgery to Door County Medical Center what was it? Well, that would have been five or 6 years ago. So another kind of impactful thing that a general surgeon did to help our community. The outpatient addition was added in 1989, so that included a new ER, new diagnostic imaging facilities. Wisely, future expansion space was also added at that time. Here you can see a picture of endoscopic procedures. We believe they were started in the late 1970s. This picture is from the 1990s. And then joint replacement surgery. This picture from the 2000s, and so just more and more technology added to the hospital over time, including a high-speed CT scanner in 2007, and then in 2010 the inpatient and ER tower as it exists today. So again, I mentioned earlier this was the first time that we had actually had private rooms in the history of Door County Medical Center. That was added in 2010. And obviously our new rooms had much more of a hospitality feel, but they were also designed by nurses. So every detail of these rooms was designed by nurses to make sure it was easy for nurses to get to the equipment that they needed while maintaining kind of a more welcoming feel to the room than we'd had in the past. Just a picture of the ER. You can see there the Ministry Healthcare logos. So we were part of Ministry Healthcare from 1999 until 2013. We've largely been locally owned and independently operated except for those years. The late 1990s were a hard time financially for Door County Memorial Hospital, and so we joined Ministry Healthcare at the time. Ministry was based out of Milwaukee, but had facilities mostly through the central part of the state. So Stevens Point, Rhinelander, Marshfield, those were all Ministry facilities. And it was a good partner for us until Ministry was sold to Ascension Healthcare in 2013. Ascension's very much a large corporate entity, and they kind of run things that way. So in 2016, our board decided the Ascension way was not the Door County Medical Center way, and we were able to leave Ascension and become locally owned and independently operated again. You'll remember my predecessor, Jerry Warwick, our former CEO. Both Jerry and our CFO, Bob Szynski, served in their roles for around 30 years. And so a lot of the changes that I've talked about over the last 30, 40 years were really orchestrated by those two. In this scenario photo of Door County Medical Center in 2016, I mentioned robotic surgery was added in 2018. And Dr. St. Jean, who I mentioned earlier, helped us bring robotic surgery in May of 2018 to Door County Medical Center. The foundation that I've already mentioned to you, still in existence today, still raising money for everything that we do at the facility. In 2019, we opened a new rehab location at Cherry Point Mall in Sturgeon Bay. And in 2019, we opened the new skilled nursing facility in August of 2019. Unfortunately, just ahead of the pandemic that none of us knew were coming, but very fortunate that we had that building and that extra space during that time, for sure. Just another picture of the Pete and Jelaine Horton Center, the skilled nursing facility there. So that's kind of a history of Door County Medical Center specifically. But I do want to go back and talk a little bit about Northern Door and the important milestones that have occurred in Northern Door. I think the first place that I would start with that is Scandia Village. This is an aerial photo of Scandia Village in 1981. So you can still see kind of that T-shaped building that still is kind of the central part of Scandia Village today. And again, borrowing from an article in the Peninsula Pulse in December of 2021 that talks about the history there. It says on October 19th, 1974, the first formal meeting was held at the Ephraim Shores restaurant to establish what would become SCAN. Does anyone in the building know what SCAN stood for? I always thought Scandia Village was named just because it's like Scandinavian or something like that, but when I read this article, it's not. It's an acronym, Senior Citizens Agency of Northern Door, SCAN, Senior Citizens Agency of Northern Door. That's how they came up with that name. In 1979, a management contract with Good Samaritan Society was approved, and so Good Samaritan as an entity has been involved in the operation of Scandia Village since the beginning. By November 1980, with the fund drive just beginning for a building that would not open for nearly a year, 24 requests for admission and 26 requests for employment had been received. So I think that's an important point, that healthcare in Door County has always been important from an employment standpoint too. And you think about how important those jobs have been to Northern Door County over the years. And Scandia Village has always been a part of that. By the time it was dedicated in October 1981, 46 more requests for admission had arrived. The first 3 residents actually settled in on November 2nd, 1981. And at that time, the daily rate for skilled nursing care in a semi-private room was $42. So in 1981, sounds like a pretty good deal today. I don't know what SCAN is charging today. I know at our nursing home, we charge about $335 a day today. So definitely a little bit of an inflation in healthcare cost over time. One of the folks that I would mention to you is Michelle Knotts, who was the Scandia Village administrator. Michelle's a great example of someone kind of moving up in the community and being very instrumental in everything that went on there. She was hired as a housekeeper in 1982, long before federal and state nurses' aid requirements were adopted. And so when they needed a certified nurse assistant, she was given a half-day's training on how to make a bed and safely move a patient, and she was promoted to that position. So when the Meadows was built in 1986, Knotts became its manager. then business office manager, and in 2010 she stepped into the role of Scandia Village administrator. So obviously Scandia Village has always been a really important part of healthcare in Northern Door County, and remains that way today. Another facility that's been important up here in Northern Door County is the clinic that was built by Mike Flood. So Mike Flood was originally recruited to Door County in 1976. There were two doctors in the area at the time, a Dr. Farmer and a Dr. Smith. Dr. Farmer was 74 years old at the time, and Dr. Smith was 84 years old. And so Mike was recruited kind of as a succession plan to the community. He was actually recruited by John Turk and Dr. Cotter and Dr. Herlash, who we mentioned earlier. After being in the community for 7 years, Dr. Herlash hired Dr. Meyer, who is in the audience today. If everything is correct that Mike told me on the timeline here, so you correct me if there are any details lost. But at that time, then Dr. Meyer and Mike Flood served the community, and then around that same time period, Dr. Traver started her own clinic as well.
Actually,
yeah.
She was hired by John Herlash a year or two before they hired me.
Before they hired you, okay.
There's also another nurse practitioner by the name of Earl Kinnear
Okay.
who worked up here as well.
At the same time?
Yes.
Okay, great.
Well, in the clinic.
Yeah. So Mike Flood, he was real honest with me. He told me about, he has history with Door County Memorial Hospital in that, Dr. Herlash didn't want a nurse practitioner. He was actually both a nurse practitioner and a physician assistant. Dr. Herlash was really set on having physicians up in Northern Door. And so they had, a disagreement over that. Mike actually left the community, spent 2 years practicing down in Neenah, and then came back and started his own practice. There were some discussions about all of the providers in the area at that time joining together and creating a clinic that would include all of them, but at that time it stayed to where I think everyone was practicing independently. Is that correct? For the most part?
In this area, yes.
Yeah, in Northern Door. Yep. So Mike's clinic, he and his wife ran that clinic for many, many years. Around 2000, as he told me, he became tired of dealing with insurance. I can relate. And Door County Memorial Hospital and Bellin wanted to bring up doctors again, so they asked Mike to leave. Because he was actually seeking a suitor. He wanted to sell his clinic, and he was asking Door County Memorial Hospital or Bellin, but both of them said, if we buy your clinic, we're going to bring up doctors and replace you. Obviously, that was not what he wanted to do. So Aurora actually offered to hire him. So that's how Aurora was brought up into this area. But Mike said, he's never been a system guy. He doesn't worry about what he called, in his words, leakage. We still talk about that today. That's kind of a hallmark of healthcare in Door County, actually, is that we don't usually worry too much about the logo on the ID badge. We let our physicians refer to whoever they think is going to best take care of patients when it comes to specialists and those sorts of things. And it sounded like from talking to Mike that's how it worked in those days as well. Another person I talked to, this isn't an actual picture of the day of, but another person I talked to was Dr. Rebhan, who was welcomed to our community in the fall of 2001. He was interviewed by Dr. Roning on a duck blind in Bailey's Harbor. So this is not the actual duck blind, but to be representative of that. So he said that's all it took for him. He knew that this was the place for him. They were out there catching bluegills and talking healthcare, and he knew that this was a place that he could raise a family and wanted to practice. So this is a picture of Dr. Rebhan and his family in those early days. Our clinic then in Fish Creek was completed in 2002. Had lab, x-ray, and Josh as the only physician. And so I asked Dr. Rebhan, I said, well, was it busy right away, or what was it? And he said, oh no. He said, like, for the first year, he could remember going out for walks in the woods and just telling the nurses to page him if a patient shows up. So, but it didn't take long because of the person he is and just what an upstanding guy he is, that he started to grow his practice then very quickly. In 2007, Dr. Arnold was added to the practice. In 2011, Holly Swain was added to the practice. Dr. Arnold left then, and in 2016, Dr. Johnson joined the practice, so Dr. Roy Johnson. And so even today, our clinic, that's now the Sister Bay Clinic, which I'll talk about next, is staffed primarily by Dr. Rebhan, Dr. Johnson, and Holly Swain, but we'll talk about some of the additions and new personnel that are going to be up here as well. So that brings us to the new clinic in Sister Bay. These are a few slides from a presentation that we did in July of 2021 for our board to really explain the situation, explain what we had done in terms of our research, and why we felt like we needed to do an expanded clinic in the Northern Door market. The Northern Door market was and still is our fastest growing market for clinic and rehab services. We did do an advisory board study, and they projected that clinic demand would grow 40% over the next 10 years, and that rehab demand would grow 60% over that same time period. That didn't have anything to do with like additional services provided or anything like that. It strictly had to do with or with population growth. They were assuming zero population growth. It completely had to do with the aging of the baby boomer population and knowing that we just needed more services and more capacity in Northern Door County. So we knew right away as we were studying this in 2021 that was going to be correct. Our projections, their projections were even, or what we were actually seeing in the summer of 2021 was actually even ahead of what their projections were going to be for that time period, so that we knew that we definitely needed to do something. Our Fish Creek Clinic was busting at the seams. We really didn't have any room to add any additional providers. We didn't have as much room as we needed to bring up rotating specialists who wanted to rotate up to Northern Door. And the same thing was happening at Rehab. We were actually leasing space from Scandia Village for our rehab facility, initially just to do rehab for their residents, but then it became a full outpatient rehab clinic. And it got to the point where only 11% of what we were doing was for the Scandia Village residents, and 89% of what we were doing in that space was for the public, and we needed a lot more space for rehab services as well. So we determined at the time that we had an opportunity to construct a combined clinic and rehab location in Sister Bay. And that's something that we had never done before. We've never had rehab and clinic co-located. So we're excited about that. In the first 2 months of operation, I'm already hearing about patients who have a conversation with the doctor. It's determined that some physical therapy might help, and they're sent directly upstairs for their evaluation that day. It doesn't always work out that way. But when it can, that's fantastic. And we look forward to the collaboration that's going to happen between the physicians and the rehab therapists just from being under the same roof. So the timeline: in fall of 2020, we engaged Caldwell Associates to help us envision and design a new building. So Caldwell Associates is an architecture firm out of Florida. And a lot of people have asked about that. You know, like, why would you choose an architecture firm out of Florida to build a building in Wisconsin? One of the things that we knew from talking to patients, one of the things that we knew from talking to our providers, is that we wanted this clinic to be different. We didn't want it to feel like a clinic. We wanted it to feel like more of a community center, more part of the community. And we wanted it to bring in natural light and the beautiful nature that surrounds us and all of those sorts of things. So we have a patient experience consultant that we've worked with for 15 years called the Studer Group. We asked the Studer Group, who have you seen around the country that really designs thoughtful buildings that will kind of get to the vision that we have for what this building could become? And they introduced us to Caldwell Associates. So that's how we got to know them. They met with our clinical teams in winter of 2021, started designing a space that would meet the needs now, but also well into the future. And then we conducted a thorough search for a construction manager in the spring of 2021 and chose Bolt to partner with us on this project to actually build the facility. Bolt is no stranger to us. They've built several of our buildings. In particular, Al, their manager who just retired, just celebrated his retirement last weekend, has been kind of the foreman on many of those projects. So they're a very trusted team, so we were excited about working with them again. And we developed a construction schedule that would have us breaking ground in September of 21 and finishing and opening in the spring of 2023. So just some things about the design. Like I mentioned, we have 3 full-time physicians who practiced in, or providers, I should say, who practiced in Fish Creek. We definitely knew that we wanted to have at least 5 full-time clinicians compared to the 3 that we had today. So to that end, one of the things that we've already done is we've already added Courtney Curry, who's another nurse practitioner, to this clinic. And Courtney is still building her practice, and at the same time she's taking same-day appointments and walk-in appointments. So a lot of times people will ask, are you going to have urgent care in the new facility in Sister Bay? We would love to have more of an urgent care model in that building, but right now it's just from a staffing standpoint, we don't have the staff who can work the weekends. But we did, from day one, we said if we're going to expand, we want to make sure we can take walk-in appointments and same-day appointments. So Monday through Friday, it's essentially just as capable as our urgent care facility in terms of diagnostics and that sort of thing. And we do take same-day appointments. So Courtney's up here now, so we're up to 4 full-time family practice providers. And then we've also added a full-time licensed clinical social worker. What that is a mental health, behavioral health therapist. So we've seen that as a need really throughout our service area. Every time we add a licensed clinical social worker to a space, their schedule fills up immediately. So we do have mental health therapy services full-time in that clinic as well. And then we're still recruiting for an additional family practice physician to serve in that clinic to just help to continue to meet the growing need and the growing demand in the community. In terms of our rehab, it's a much enlarged gym space. It's about twice as big as the gym space that we had over at the Scandia Village location. Additional therapy rooms to allow for flexible programming. So we have some additional programming that we'll be able to do here than in the past. Folks had to travel to Sturgeon Bay for some of those services. And then also in talking with the community, because we did focus groups for this building, one of the things we kept hearing about was pharmacy services. And when Shopco had closed, there was definitely a need to bring some stability to pharmacy services here. So there is a hometown pharmacy here. We initially had talked with them about whether or not they would be interested in moving their operation over to our clinic. And those discussions were going well, but they had some changes in their corporate structure that didn't allow that to happen. So, so they still exist, but we are starting our own retail pharmacy that'll open in September in our space as well, so that folks can get their prescriptions filled right when they're there, or can just come in off the street and get prescriptions filled. They don't have to be prescriptions written by our physicians. Another thing that we have on the second floor of the new clinic is some community space. So that's another thing that we heard from folks is we need more meeting space for community meetings like Parkinson's support group and cancer support groups and those sorts of things. So we did create that new space. We're still in the process of furnishing that with AV equipment and furniture and that sort of thing. So it's not quite ready for public meetings, but just know that that's going to be available as well. It's a large classroom. It's about the same size as this room here. And so if you have a need for public meetings and you think that that would be a good spot for it, know that that's going to be available at some point very soon. In terms of the actual design itself, I don't think I can talk about it without talking about the roof. Everybody wants to know about the roof, and I give Michael Crawford, our architect, a lot of credit. He came up and spent a lot of time in Door County and really tried to understand the architecture that he saw around the area, plus understanding the roots of that architecture in Scandinavian countries. And that prominent roof line is something that you definitely see in architecture in Scandinavian countries. So that's kind of where he came up with that. But the first time we saw the design, we loved it, but we knew it was going to be something that people would either love or they would hate. Either way, I'm gonna file that under the category of all publicity is good publicity, and so that's how the roof line came to be what it is today. But we're excited about the architectural look and feel of it. It does definitely meet the goal of bringing in natural light into the facility much more than our previous facility had in Fish Creek. So we think that's a good thing too. When we were looking at different sites, I do want you to know we did consider a lot of different options. We considered expanding at our current then current location in Fish Creek. The property in Fish Creek, I don't know how well you can see this, it's really an odd-shaped property, and so that made expansion really difficult. Plus, we didn't have very good visibility for that clinic. And at the time, we were trying to envision how we would put the amount of space we needed on that piece of property, and we just couldn't figure it out. And now that our new clinic's built, and I look at it and I look at the size of it, I think that never would have fit on the property in Fish Creek. So definitely glad that we moved away from that idea. We did look at other existing buildings in town, Shopco building included, before we decided to build a new building. Ultimately, that was actually going to be a more expensive option to retrofit the Shopco building into a clinic. So from an affordability standpoint, we just had to go ahead and build at the new location. But the new location was a clinic back in the old days. So it's not the first time that location has been a clinic, and it is again. So it was a projected cost of $14.5 million. You know how inflation's been lately. It ended up costing about $15 million for the project. But again, it doubles the size and really doubles the number of services that we can provide from that location. So that kind of brings us to present day. But what questions do you have, either about any of the history that we discussed or about the new facility? Yes?
Are you still working with the scan? How is that going? You're out of there, but they still...
Yeah. So the question was whether or not we are still working with SCAN on the services that we provided there. So yes, we absolutely are. So for nursing home residents, the rehab services need to be provided in that building. And so we do still do that. Our therapists still go over there, and we maintain a space in that building where we're able to provide those services to the nursing home residents. For the folks who live in more of the independent living settings, they're coming over to our new facility. But we've always had a really strong relationship with Scandia Village and really Good Samaritan as well. You know how important that organization has been to our community in terms of long-term care, in terms of the rehab services provided there, and all of those things. And so we definitely want to continue to see a strong Scandia Village. I'm going to answer more than your initial question, because I think somebody would probably ask about it. But people have asked, have you looked, as Door County Medical Center, looked at buying Scandia Village? It is something that we've had conversations with Good Samaritan about. It is something that our board very carefully considered. At this time, it's just really not a good time in the life of our organization to do that. You know, we have other strategic plans that we need to focus on, and we worry that kind of relationship and the investment that needs to be made in that facility would kind of take us away from the other things that we need to do as an organization to make sure we're prepared to serve the community as a hospital and clinic for the next 20 years. So at this time, we're not going to be purchasing Scandia Village, but we've been talking with Good Samaritan, the organization, all the way along, and want to support them in any way that we can. So, you know, even today, we do training over there, we share resources in various ways, and we'll definitely continue to do that. Yes?
Hi, Brian. As a new Door County resident, can you give some advice on accessing urgent care services?
Yeah, I'm glad you asked, because I brought some materials along. So over on the table over here, I did bring some materials along about Door County Medical Center, and specifically about our on-demand services. And I'm going to say on-demand services because there's about 4 different ways that you can access us on demand. The most expensive, the most complicated of those ways for the most complex problems is the emergency room. So obviously, if you have a true emergency, that's the place to go in Sturgeon Bay. We actually have a new Door County Medical Center app that is being released. It's actually already out, but the publicity will go out on that this week. So if you want to download that on your smartphone, the first thing that comes up on that app is on-demand care. And it shows you like our ER wait times, how long you would have to wait if you go into the ER right now, shows you what types of services you would want to go to the ER for. The next level down is urgent care. And so urgent care is for more of those minor illnesses and injuries. Again, on the My DCMC app that is out right now, you can see wait times there. You can see typical busy times on the website, so you know when it may be less busy to come in for urgent care services. But again, that's minor illness and injury. It is right across the hall from our emergency room. So if you're not sure and you come to the urgent care and it's something that really requires an emergency room physician to see you, we send you right across the hall, and that's all well coordinated from that standpoint. But our urgent care is more capable than most in that it's right in the hospital, so we do still have advanced imaging services and those sorts of things. So we can do quite a bit in our urgent care setting. The next level down is something that we're calling direct care. This is something that's completely new. It opens in Sturgeon Bay on June 26th, so next week. And it essentially is for, again, minor illness, primarily minor illness, not so much minor injury. The main difference with direct care is we don't have x-ray services in that clinic. But about 80% of what we do in urgent care we'll be able to do in the direct care setting as well. That'll be staffed at any given time just by 2 people, a nurse practitioner and an assistant there to help the nurse practitioner. And we're intentionally keeping it simple to keep the price down in that location. So we're trying to create another price point that's more affordable for folks who are struggling to pay for health care. And it's a $100 flat fee for a visit to that facility, unless you choose for us to bill insurance, in which case we bill it at the regular urgent care rates for that. But a lot of folks have either a high deductible plan or they don't have insurance, and so that $100 flat fee, we believe from talking to folks, will be appealing to them. So there's direct care, and then the final level is virtual care. So on our website, for services like rash, tick bite, respiratory problems, you can actually do a virtual visit for $35 on our website or on the My DCMC app as well. So kind of 4 levels of care there, all on-demand services without needing to make an appointment. And if you are curious about those, we've got some brochures over here that further describe what types of services would be appropriate in each setting. Good question. Thanks.
So is that those 4, which ones, do they all go through insurances or like we're on Medicare?
Yeah, the only one that doesn't go through insurance is virtual visit. That's truly just a $35 cash visit. Every other setting we would bill Medicare.
So they just really do.
That's correct. Yep. Yes.
Staffing is a real issue at the Scan and at the Meadows. I'm wondering if you're experiencing the same thing.
Yeah.
And that's mainly, it's not necessarily the professional staff, but it is the support staff.
Right.
And I'm wondering if you're experiencing that, and if so, how are you dealing with it?
Yeah, great question. So the question was about staffing in particular, and how, the period of time that we've been through over the last couple of years has been labeled the Great Resignation. So how has that affected Door County Medical Center? Certainly we have been touched by that. Maybe in a different way than some. We don't usually see people leaving just for the sake of leaving. We don't normally see people leave for higher pay. We typically pay pretty competitively compared to others in Northeast Wisconsin. But what we have seen is a lot of stress in healthcare over the last several years with the pandemic. And so we have seen people leave healthcare altogether to find less stressful jobs. We've also seen early retirements, so that has impacted us. At one point, our turnover rate got down to, I think, around 15%. So about 15% of our staff turned over in 1 year. Now that's about, like pre-pandemic, that's about the industry average, honestly. But for us, that was our worst point. Our turnover rate is now back up to 8%, which is very, very, very good. And we've actually seen a difference in the hiring environment too since January. And I don't know what changed particularly, but since January 1st, we've hired 45 people at Door County Medical Center. So we've definitely seen a lot more success in filling our positions within the last several months. So what have we done to create that? I mean, some of it is just market dynamics, but certainly we've enhanced our benefits, and we continue to do that. We're constantly looking at our benefits and seeing what we can add. So this coming January, we're going to be adding a paid maternity leave and paternity leave component to our benefits, which we've never had before. So always looking at adding benefits and making sure we're competitive. But our main thing is our culture. You know, we really focus a lot of time and energy on what it feels like to work at Door County Medical Center. We want to create an environment where people feel empowered to do whatever they need to do to best take care of patients. And I think people appreciate that. So that's why our retention rate is so high, is, you know, folks don't want to leave that environment. And if we can get people to try us out, they generally love working at Door County Medical Center. Our institution is full of people like our chief nursing officer, who says she came to Door County Medical Center for a courtesy interview and was kind of hooked right away, thought maybe she would stay a few years, and now she's been here for 20 years. So that's typically what we see based on our culture at Door County Medical Center. Yes?
I just want to comment, because you just mentioned the nursing director, that my husband and I eat at your cafeteria when we have an appointment. We were told by the checkout clerk that we didn't need to pay for our meals because the woman behind us was paying for our meals.
Oh, really?
And when that happened, I turned and said, "And how is this happening?" And she said, "Well, we just want to make you feel welcome, and I'm the director of nursing, and I'd like to do it." I was just blown away.
That's very nice. Yeah, that's very nice. And I mean, that's wonderful, and I hope that's not an isolated incident, and I don't think it is. I think our staff does a great job every day of kind of creating memorable experiences for our patients and doing things that are a little bit above and beyond, often for the family member of patients who don't expect the care. But yeah, wonderful to hear that, and I'll recognize her for that. Thanks for doing that. Yeah.
I just have one comment to make. My husband and I were both patients in the clinic, and when that clinic closed, we did not want to have to drive down the street there, so we switched. The switch over from Aurora to your clinic was absolutely phenomenal. I mean, it was so easy. They also, which is something that I really appreciate, they also are able to, they will keep us, they will allow us to use the same physicians like the heart doctor.
Right.
I mean, they can't, they just go right into that, and
right.
They work together, which is really, I really appreciate that.
Good. Yeah, thank you. And that speaks to what I was talking about earlier, is we never pressure our physicians on who they need to refer patients to for specialists. We really want them to be able to choose, and we provide them as many options and as much information as possible. And so, yeah, that stands to reason that, you know, if you didn't want to switch cardiologists by coming to us, they want you to stay with your cardiologist for sure. Yep. Yes.
I do want to say that I'm glad you have the cancer clinic up there.
Thank you.
That was one of the best things.
Yeah. Thank you. So, in case y'all didn't hear, she was talking about the Door County Cancer Center, which has been our most important partnership. We partner with, you know, Bellin for things, we partner with Aurora for things, we partner with HSHS, that's Hospital Sisters Health System, and St. Vincent and Green Bay for various things. Even before we were formal partners with St. Vincent like we are today, we had partnered with them on the Door County Cancer Center about 20 years ago. And that has been the most important partnership for our community, just in terms of patients not having to drive to Green Bay for those services if you're getting radiation on a daily basis or several times a week, but also just in what Green Bay Oncology as a group brings to Northeast Wisconsin and brings to Door County. So Green Bay Oncology is really one of the top 100 oncology practices in the United States, and so to have those physicians practicing in our facility and in our community is super important. So thank you for mentioning that. Any other questions? Yes.
Can you talk a little bit about emergency services and ambulance services and triage to facilities outside the area?
Yeah. So the question was about emergency services and triage and when we have to transfer patients outside of the area. And that's been, I'll tell you, transfer has been a real challenge over the last several years. So by state law, every hospital in Wisconsin is responsible for safely transporting their patient to a higher level of care when a higher level of care is needed. In our community, we've been very fortunate to work with Door County EMS, you know, as you saw in the slide, for many, many years as one of the first rural paramedic programs in the country. And they continue to be a great partner today. I'll come back to that though. Anytime we can't take care of a patient in our ER, we immediately start calling to facilities down in Green Bay to transfer them to the appropriate location. And we don't really, usually our first call is to St. Vincent, but we'll transfer to any of the hospitals in Green Bay that can best take care of the patient depending on their condition. We also have transferred beyond Green Bay. So, we'll transfer to Freighter, to Mayo, to Marshall Clinic at times, UW at times. So it just depends on the scenario. So we have relationships with all of those facilities to be able to make those transfers when they're necessary. Transport services specifically have been a challenge. We had a company in town called Paratran for many years, and Paratran was a locally owned company in Sturgeon Bay. And anytime we needed to transfer a patient, we were able to call them and they'd bring the rig over right away and get the patient down to Green Bay or beyond wherever they needed to go. That business became a lot harder from a reimbursement standpoint and from keeping the equipment up and maintained well and all of that. So Paratran had to go out of business several years ago, and since then we've had to work with companies in Green Bay on transport services. So now anytime we need to transfer a patient, at a minimum it's an hour before the patient gets transferred because we're calling somebody in Green Bay, they have to bring up a rig and then take the patient back down. In reality, the wait times have been even longer than that because we're just not their first priority. So over this past year, we've worked with the Door County Board of Supervisors and County EMS we're going to now be supporting their operation financially in some ways so that they can be our first call for transport services, so that they're not only providing 911 services, but that they're also providing transfer services as well. So that's going to go live this fall. They're hiring for that right now to be able to make that happen, and it's a great partnership between Door County Medical Center and the County of Door to be able to do that. So that's going to cut down our transfer time dramatically. Other questions? Yes?
I just wanted to make a comment on what you were saying. A year ago, January, my husband was brought into the hospital and needed to be transported, and he was airlifted to Freighter in Menominee Falls because they couldn't find anything else around. We never got a bill for that, so I don't know if it came out of your retirement fund.
I don't know. That's a good question.
I mean, it was just amazing that what they did and how they treated him, and he needed, lots of good care at the time.
That's wonderful, and it has been like I say, a challenging time from a transport standpoint, but also from finding a receiving facility. I mean, it's been common in the last couple of years for the Green Bay facilities to be full, and I know that must have been the case. If your husband was transferred to Menominee Falls, that must have been the case, that we just couldn't find another. Yeah. We were trying to find a facility that had an open bed, so no, but I'm glad that worked out. I have no idea about the bill. Not sure. not sure what happened there. So. Good. Any other questions? Well, this has certainly been a pleasure for me. I do appreciate you inviting me up tonight to talk about the history of healthcare in Door County, for teaching me some things as well. Dr. Meyer, would you mind just introducing yourself to everyone too? We got one of our long-standing physicians here in the community.
I'll explain how I got up here.
Do you want the microphone? Sure.
I owe time to the United States Public Health Service because my last year medical school I ran out of money, and I went to the bursar's office and they said this may be the first time that we've had to expel a medical student. You can't pay. So I got a scholarship which made me provide 2 years of care to the Public Health Service. Then President Reagan cut the funding. So there were, long story short, 1976, the head of the Public Health Service said, because of antibiotics, we don't need public health anymore. So Reagan cut all the funding. There were 1,300 of us that were supposed to go out and practice in the Public Health Service. And they said, we've got enough money for 200. The rest of you are going to have to find a job someplace that will pay your same salary, but you still have to put the time in. So anyway, Northern Door County was a physician shortage area. And that's how I got up here. And to be honest, Dr. Farmer was gone long before I was. Mike Flood was here. They had already hired Dr. Traver previously. Debbie Mann was one of the people that worked at the clinic there, so she knows a lot more about the clinic. But anyway, I got here just because I needed time in the public health service, which I didn't get any credit for it. And then, as you were saying, in the 90s, funding got really bad. And they would pay somebody who had a nurse practitioner or a PA working for them, Medicare would pay more money to a physician. Well, I couldn't afford the salary I was getting, so how could I afford anybody else? So I joined the Air Force. And unfortunately, they screwed up my contract as well, so I ended up spending 2 years working in the emergency room in Sturgeon Bay. So I was up here from 81 until 92, and then 92 to 94 I was there, and then I spent 20 years and 5 days in the Air Force, and came back because I love Door County. I must say, I'm very impressed with the hospital now. When I left, we had a bunch of older physicians. I don't know if any of them were board certified whatsoever. I don't know how many we have in the hospital now that are, but I'm sure the majority of them are. And they have excellent training. It was rather a political problem going on, as I was saying. I think Memorial Hospital was because the people could put in a life insurance policy for $1,000, and then they could become a member of the stockholders of Door Memorial with that $1,000 life insurance policy, which would go to the hospital upon their death. And with that, they could make votes as to what was going on with the hospital. The hospital was in shambles, and then I went through 4 different CEOs. They didn't always call them CEOs back then.
Right.
But anyway, so I went through 4 different during the
Administrators.
During the 14 years that I was involved with the hospital. Lots of changes. I think it's wonderful what the hospital has done, and I think it's always going to be improving. Medical care has been difficult here in Northern Door, extremely difficult. Being 25 miles away from the hospital, I made 4 trips one summer day seeing patients in the hospital. It was crazy. It took me an hour down, an hour back, 4 different trips. Well, that was my whole day, just on the road.
Yeah.
So anyway, I'm glad that the hospital is doing what it's doing. I'm glad that they're bringing more people in, and I'm very impressed with everybody that I met at the hospital now, with the training and the abilities. So.
Thank you very much. Thank you, Dr. Meyer. And you mentioned the health professional shortage area. Northern Door was still a health professional shortage area until, well, now they're on the list to remove that designation. So it has been a physician shortage area all this time. So, but now we're finally getting beyond that. Mental health, though, we still need twice as many mental health professionals in Door County just to reach the national average. So we still definitely have a ways to go there. So. Very good. Well, if there are no other questions, I certainly appreciate your time and look forward to enjoying some cookies and lemonade with you. Thank you.